a simple conversation. I think going from the biomedical model to the biopsychosocial model is quite profound. My colleagues, Helena Hansen and Jonathan Metzl, have been doing a lot of training in the United States on the issue of structural competence, how to help doctors be structurally competent. And so they had asked me, among others, but they'd asked me to write a paper for a set that was going to be in the New England Journal of Medicine. And so I wrote about our work in, this kind of work at the level of community, making connections to create the social foundation for health. And the comment from the editors at the New England Journal of Medicine was, but how does this relate to the clinical? Like a patient walks in the door and I say that, like, they could understand a person walks in the door, they're homeless, I send them to a social worker to get housing. That was about as structurally competent as the New England Journal of Medicine was able to be at that moment. So this is a tough uphill struggle, that there are social foundations of health, that the NHS is located in the places, and so they have to look around. But the other thing is that they can't, if you say each one should do it, you wouldn't get the tangle. So it's sort of resources here and no resources here, that's the tangle. And so how do you start to say there's inequality, there's isolation, there's lack of solidarity? How do we recreate those social bonds? And, I mean, again, I speak very humbly about your society. It would seem from the outcry over Brexit that there's a lot of xenophobia and racism in British society that you're trying to grapple with, but those are hard things. There's lots they can do. I think to some extent it depends on structural competence. I think that were they to go into communities now, they could very likely go with the dominant lens and miss the subtleties of social bonds because they haven't been trained to see them. So you'd want them first to get some training in structural competence. My colleagues, Molly Kaufman, Lourdes Rodriguez, and Bob Fullilove and I wrote a paper called Urbanism as a Participatory Sport, which is in Helena Hansen's book about structural competence. And the point we wanted to make is that we had to teach our students something about the structure of cities and urban ecosystems, how they work. And we had to take them to projects that we were working on where they could learn from community people. They quickly understood how to work in communities, and then they could do great things. I don't think it takes much, but it does take some orientation because we are very stuck in the biomedical model. So if we're going to go outside the clinic, we'll have to be prepared. So we have to take structural competency seriously, and don't just send another bunch of do-gooders out. That's not useful. We have really serious problems that are not in the textbook of medicine or surgery or psychiatry. As I said, when I started to study cities, I did this tutorial with Michel Cantal-Dupart for 20 years so that I could learn cities. So I feel very comfortable now saying this is what I think about a city, but I didn't even know what a city was 20 years ago. So when people start, saying, oh, I'm going to do urbanism, I get very tense. Like, well, could you please go visit some cities and learn some things first? Mm-hmm. We don't need more nonsense. Well, community development is premised on that, and we all know that community development, for example, in Orange, New Jersey, there's a community development corporation that over 30 years has added about 130 housing units, maybe a little more. And then there's a new development proposed for a former hospital site, which could get done in a couple of years and which is going to have 500 units in 2 or 3 years. So the scale of the money that people in community development can access is nothing compared to what's going on in capitalism. And also because at this time, the financialization of housing has moved to, I mean, I'm not a finance person, but the finance people tell me that it's moved to a whole new level, especially because the capitalists have accumulated so much money and they're parking it in real estate, driving up prices, creating new ownership patterns, driving huge new developments. How can a community corporation go up against that? They can't. So the whole system is very distorted at this point, which is why this fundamental conversation about what is habitat
Mm-hmm.
is something to which we can contribute, because we know that lead in paint is bad. We know that pollution in the air is bad. We know a lot about habitat, but we don't tend to talk about it as habitat. We tend to get siloed, right? Like lead poisoning and this and that. But we can put it together and say, we understand habitat. This is what makes for healthy people. That's what we want, is healthy people. So it's that we could do good in that domain. Because it has to shift. The conversation has to shift from profit to habitat. If you make profit by destroying habitat, you're cutting the ground out from under all species. At what point does that become the sixth extinction?
Mm-hmm.
Well, I think one should challenge the premise how best to serve their needs. I think when we face a species level event like climate change, it's all of us. Everybody's like, well, I have privilege, so I'm protected. Privilege. There's probably a most privileged dodo bird. There probably was. Had all the best things a dodo bird could have.
Yeah,
But that dodo bird is gone. So there's a privileged human being that has all the best things a human being could have as we understand it, but could be gone if we don't take care of the habitat. So I think we have to drop the idea that somebody has privilege or somebody has this or somebody has that. If we're not all in this boat together, you're deluding yourself. So it's not to serve their needs. As we are in this together. You know who often has the very best way of putting a complex idea into simple words is Alcoholics Anonymous, which makes sense because alcoholics arrive at Alcoholics Anonymous and their brains are half rotted, right? They're coming off decades maybe of intoxication. They can't think very straight. They need very simple instructions. And all alcoholics arrive at Alcoholics Anonymous and say, I don't belong here because I didn't fill in the blank. And so they're on their way out the door. And then somebody will say to them, identify, don't compare. Now that's a very simple instruction. Identify, don't compare. But it stops them in their tracks because what they're doing is comparing so they can get out the door. But if they have to listen for, well, what do you hear something that's like you? Can you just be like this person? Then you open up the domain of suffering, because there isn't anybody who's an alcoholic who hasn't suffered. And as soon as you start to say this is about suffering, then people can get together. It's the most simple instruction, but if you think about it in our daily lives, anybody you meet, you can either identify or compare. So I can serve you because I think I'm better than you. I have something to give you. But I can be in solidarity with you because I'm really scared too. So I was thinking this morning that, why does it matter so much to me? All of this. I just gave our research group, we just gave our papers to the archives at Columbia. So we're really invested in there being decades of researchers who could look at our papers, but that's pretty selfish. But, a little bit less selfish, I have one great grandchild, and I would really like him to be able to eat tomatoes and talk to elephants. That would be cool. So these are investments, and for that, I'm willing to work really hard to invent a future in which the habitat is supportive of all creatures. So identify, don't compare is the simplest, most useful instruction. And anytime you're puzzled about how to give a lesson to somebody, you could call up your favorite alcoholic and say, what do they say in AA?